we go from here and then we come out just to get this part of the hooding that comes down here. And the incision, even if we come out, really does heal well. So we spend some time making those markings. The incisions might not be exactly symmetric on both sides, but that's because people age asymmetrically and are asymmetric to begin with, and they might have different amounts of skin and different shapes of skin that we need to take out to make it look more symmetric afterwards. Hey guys, it's Dr. Samir Undavia from NJENT and facial plastic surgery. I wanted to talk to you about upper eyelid blepharoplasty, what it means to have it and what it's like to have it, and what happens afterwards. So upper eyelid blepharoplasty is the official name for upper eyelid surgery. Some patients call it an upper eyelid lift, where we're taking out the excess skin and fat that's right here. So it's really a surgery for the aging face. It helps you look younger, and it helps you look like you have a really nice, refreshed look, like you had a great night's sleep. So let's get into the nitty gritty about how it's done. So first, the vast majority of patients who are having this done by itself are doing it in the office under local anesthesia and driving themselves home. That's how straightforward this is. Some patients like to do it in the office with some Xanax, and then they have a friend or a family member drive them home. If your drive is like 2 or 3 hours, I would have a friend do it with you. But if your drive is 20, 30 minutes, I really think it's pretty straightforward. You can probably drive yourself home. So what happens typically, first of all, patients can eat and drink that day. There's no restrictions that morning. You can take your medications, although we will go over which medications are a no-no for this surgery. So when you get to the office that day, the first thing I'm going to do is spend a bit of time marking out the incisions. And what we like to do is have the lower part of the incision about 1 centimeter above, or 8 millimeters above, the eyelid margin. We also like to have the upper part of the incision about 1 centimeter below the eyebrow. So that limits how much skin we can take out. Sometimes there's actually a little bit of extra skin that we must leave. And the reason is we don't want to make this incision look artificial. We want it to fit within the natural crease of the eyelid and look like you had nothing done. And we don't want to pull down the eyebrow or pull up the eyelid margin. So it's important that we kind of keep to those parameters. So for men, we like to keep the incision in this part of the eye, although a lot of times we have to go out a little bit just to get this hooding right there. But men don't typically wear makeup, so it's a little harder to cover this part of the incision. So for women, we go from here and then we come out just to get this part of the hooding that comes down here. And the incision, even if we come out, really does heal well. So we spend some time making those markings. The incisions might not be exactly symmetric on both sides, but that's because people age asymmetrically and are asymmetric to begin with, and they might have different amounts of skin and different shapes of skin that we need to take out to make it look more symmetric afterwards. So once we get our markings done, then we're injecting with a little local anesthesia. And we do that, number one, so the patients don't feel the surgery. But number two, it helps with bleeding during surgery also. Occasionally, patients feel like their heart races for a minute or 2 minutes, but then that goes away. And that's from the epinephrine part of the anesthesia injection that we put in. Also, there's just a little bit of anxiety in injecting the eyelid. But again, it's about 25 seconds on both sides, and then we're done injecting. And that's all that patients feel afterwards. So then we wait about 15 minutes, and then we get started with the upper eyelid. And what we're doing is first taking out the extra skin. So we take out the skin, we leave the eye muscle down and intact. Then sometimes there's a little fat right here and right here that we need to remove. Really occasionally or seldomly, we need to lift up lacrimal gland or the tear duct gland that's over here, but that's really not that common. Most common is removing skin and then a little bit of fat on the upper eyelid. Once we do that, then we've got to put blue sutures to close the incision. Usually there's a loop on one side and a loop on the other, and then a few intermittent stitches in between. And that's it. It's hard to put tape or a dressing on the eyelid because you've got to blink and open your eye. So what we do is we just put antibiotic ointment on there. I also give patients antibiotic pills to take for a week just in case, or prophylactic, and then Tylenol with codeine, which has just a little bit of the codeine narcotic for pain, but this is really not a very painful surgery. Most patients are using it to sleep the first night, or they're just using extra strength Tylenol. I don't have patients use aspirin or Motrin just because that can cause some bleeding issues afterwards. I usually see patients 1 week later, and I'm just taking out stitches, and then I see them around 3 to 4 weeks after that, and at 3 months, just to check on things. Occasionally, I'm putting a little steroid injection in if there's a bump on the incision, but typically there's not much else to do. After about 10 days, most patients can wear makeup. After about 10 days, I like everybody to put a layer of moisturizer and sunblock on the incision, because the incisions look great, and in general, when your eyelid is open, you're not seeing the incisions. However, when you blink or when you close your eyes, you can see the red there. Especially for the part that comes out here, what I like patients to do is use sunblock even on cloudy days, because that's the area that's a little red, and that's the one telltale sign that they might have had something done, at least for the first few weeks. After 6 to 8 weeks, it's really hard to see the incision. So a few questions that patients have. One, when can I get back to work? I would say that if you work from home, you probably can work through that first week. It's not particularly messy. You just have some swelling. And usually if you're working at a computer, you're really fine. It's not that painful. If you're working in an office setting, I would probably take off the week, just because otherwise everybody's going to know that you had something done with the sutures that are there. It is a little easier to cover it up if you wear glasses, but in general, it's still hard. And you can't put makeup on for the first 10 days or so. After that, patients ask, when can I work out? Typically, like a really good firm workout is about 3 weeks, although walking immediately is fine. I don't want you to lift anything above 25 pounds or so for the first 2 weeks. How long does it last? So most patients will have their permanent result. They will always be T minus 10 years, or however many years you look younger. You will always continue to age. So skin will grow slowly again. And, sometimes patients at 15 to 20 years, they might want to have a revision upper bleph. Other patients are just happy with the fact that they're now T minus 10 years for the rest of their life, and they just look a little bit more youthful, a little bit more bright. The vast majority of patients come back and they say their friends didn't notice that they had a surgery. They just thought that they got a really good night's rest. And so that's really what you want to hear. You want to look like, oh, you look really refreshed. Like that's exactly what you want to hear. They also asked, is this painful? Not really. We talked about just using plain Tylenol to cover any of the discomfort. The biggest thing is really just some of the swelling and bruising that happens for that first week. It's typically restricted to the upper eyelid, although sometimes it can be on the actual eye itself, and then sometimes it comes down to the lower part of the eyelid here. But it's a really straightforward recovery. It gets a little bit more of an intense recovery if we're combining it with a facelift or with lower eyelid blepharoplasty, then you're having a little bit more swelling and bruising. But in general, upper eyelid surgery is very doable, and then you get back to work within about a week. Hope that helps. Let us know if you have any other questions.